A common pattern between patients and healthcare providers is to consider the provider the all-knowing expert, and for patients to do what the provider says without question. However, patient advocates and healthcare providers alike now recognize the importance of patient and provider teamwork. By working together, patients and healthcare providers can better manage the issues a patient experiences, including pain. Several issues can cause tension between patients and healthcare providers as they talk about opioids. These issues can include the ongoing stigma about substance misuse in our society, the risks for accidental dependence on opioid prescriptions, provider reluctance to prescribe opioids, and patient worries about being seen as drug-seeking, their pain not being taken seriously, or being seen as disrespectful to a provider if they question a recommendation. The resulting miscommunication from these issues can have lasting effects on the patient-provider relationship. The miscommunication can also affect whether the patient's needs are met. To overcome these challenges, patients and healthcare providers need to talk openly. Patients and healthcare providers also need to engage in what is known as shared decision-making. Patients and providers can come to an understanding about patient choice and treatment options, as well as patient and provider treatment preferences. It is important for patients and healthcare providers to make informed treatment decisions together. Shared decision-making steps that patients can take include: state what you think you need. Tell your provider what you would like to accomplish for your pain management, and ask for their help to achieve this goal. Be open. When asked questions, answer them as honestly and as completely as possible. Providers do not ask questions to be nosy, but to provide the best personalized care possible. Ask questions. If you do not understand something, ask the provider to repeat the information or explain it in a different way. Have a plan. Before going to your healthcare provider visit, make a list of the things you want to discuss. Think about how to describe what you experience. Rank your concerns in order of importance, and discuss the highest concerns first. Through this module, you have learned what shared decision-making is, how to have shared decision-making discussions with healthcare providers. Please click to the next video to review opioid prescription questions that patients can discuss with healthcare providers.